representatives from development partners and non-governmental organizations, distinguished guests, community health volunteers, ladies and gentlemen, all protocols observed. On behalf of the UNICEF country representative, Dr. Manisa Zaman, I am extremely pleased to be here this morning and feel a great privilege in joining this festive day. I hope that everyone present are doing well, keeping healthy and safe, themselves and their families as well. My colleague from AMREF has already expanded and provided many inputs covering many different aspects, so I will try being brief, complementing a few additional elements. First, on behalf of development partners and UNICEF, I would like to start by appreciating the effective response that the government of Kenya has taken in the fight against COVID-19, including the COVID-19 vaccination rollout to protect the people of Kenya against the outbreak. And this effective response, under the leadership of the Ministry of Health, has been very closely reflected in the commendable response by Nairobi Metropolitan Services, which has been and still is the epicenter of the outbreak here in Kenya. The leadership of the government of Kenya in providing policy guidance and all counties, including Nairobi Metropolitan Services, is highly appreciated. While COVID-19 has really had disastrous effects on the health, the livelihoods, and the general well-being on many individuals and their family and community members, including children and women here in Kenya and in Nairobi, it has presented an opportunity for increasing the resilience of the health system and has demonstrated once again the importance of a strong and functional community health system. We know that community health volunteers are supporting community-based surveillance to promote prevention measures and referrals, as well as supporting home-based care and treatment for positive COVID-19 positive patients. We know that as community health services and the community health volunteers, as they were important in the COVID-19 outbreak response, their importance in the day-to-day delivery of community health services to children, women, elderly, and all members of the community is of immense importance and cannot be overstated. This is especially important in supporting the attainment of universal health coverage that the government has already invested in community health services and primary health care even before the COVID-19 outbreak. The extremely ambitious targets of the government targeting over 90% coverage of community health services across the country, including here in Nairobi and its metropolitan services, is highly appreciated by all development partners, and we would like to highlight that Kenya is currently being appreciated as one of several leading countries in sub-Saharan Africa in the way that it's really recognizing community health services as a critical pillar of the health system, critical for achieving universal health coverage. As mentioned already by my colleague Dr. Meshka from AMREF, Nairobi Metropolitan Services has joined the league of 8 counties within Kenya who have already launched the Community Health Services Bill, an act to ensure that community health volunteers and community health services are systematically appreciated, supported, and remunerated in order to perform their role. distinguished guests, allow me to share a little bit of information regarding UNICEF. UNICEF is a United Nations agency responsible for advocating for children's rights and working in over 190 countries across the world to protect the rights of every child, including here in Kenya. UNICEF mission and mandate is to advocate for and support ensuring that all children enjoy all their fundamental rights, that all their fundamental needs are met to expand their opportunities, to ensure that they reach their full potential, and of course, as part of that, ensure that they have access to life-saving health services, including community health services. Given the multiple deprivations, children and risks that children are facing, and households and communities are where the journey to achieve the children's rights begin. As such, UNICEF has a focus in supporting governments at national and subnational level in reaching every child, including through the Community Health Services platform. In Kenya, UNICEF, together with other developer partners and other United Nations agencies, UNICEF is supporting the Ministry of Health and counties in strengthening community health services as a foundation for strengthened primary healthcare services. UNICEF Kenya has supported and will continue supporting the Ministry of Health and the counties in the rollout of the Community Health Policy 2030 and the Community Health Services Strategy 2020-25. We are also supporting Nairobi Metropolitan Services and multiple other counties to establish and operationalize Community Health Services Acts and bills, and within that, operationalize community health units, as well as supporting the implementation of these bills to ensure that community health services are implemented in a sustainable manner. Here in Nairobi, together with other development partners, UNICEF Kenya has been part of the team that provided support towards the development and the approval of the Community Health Services Act and Bill, which is being launched here today. That includes also support in the training and deployment of community health volunteers who have been provided with data reporting registers and bags, together with visibility material, reporting tools, in order to support them to perform their duties. Today is a festive day, is a special day that we are really proud of contributing and joining to together with other development partners. We would like to thank the Nairobi Metropolitan Services and the Ministry of Health and your leadership, Waziri, in reaching this special day today here in Langata. Ladies and gentlemen, on behalf of the development partners, I would like to congratulate Nairobi Metropolitan Services for passing the Community Health Services Act and Bill, and for the commitment to continuously operationalize it by launching it today. The launch today is only the beginning of the journey, and Nairobi is, as I said, joining the group of the 8 counties that have recognized the importance of community health volunteers as a community health service providers at level 1. We would like to congratulate Nairobi Metropolitan Services for putting measures in place to allow the volunteers to be supported financially and through supportive supervision, to stay motivated and regularly receive the supplies and commodities that they need in order to perform their work, including job mentoring and coaching, to be able to effectively, efficiently, and as we have seen this morning, innovatively, to continue saving lives. In conclusion, UNICEF is glad and proud, together with other development partners, to be part of this joyous occasion, and we are looking forward to being part of this journey together with other development partners to ensure that all people in Nairobi, in all parts of Nairobi and all parts of the country, have access and receive high quality preventive, promotive and curative health services close to home at the community and household level, with a very strong support and well-established linkages to primary healthcare facilities. Thank you very much, ladies and gentlemen, and once again, congratulations to the Nairobi Metropolitan Services for this great achievement. Thank you.
Thank you very much, Mr. Manisa Saman, Country Representative for UNICEF in Kenya. Mheshimiwa Waziri, wakati huu ningependa kuchukua nafasi hii nimuite CEC in charge of health, Bwana Hitan Machefdia, akuja asumuzi na achukue program ile imepaki pande hiyo na alike wengine. Karibu. Karibu Mheshimiwa.
Thank you very much, Bwana CS, my brother Mutai Kagwe, DDG, Mr. Kangete, Nairobi Women Rep, my sister Esther Pasaris, my chair of Health Committee in Nairobi County, Peter Warutere,